Well, for surgeons who do a lot of operating, especially laparoscopically or robotically, one of the things that can happen is that the needle flies off in the middle of the operation. And it can be quite frustrating when you lose the needle, and it can add lots of time and anxiety to the case. And it's frustrating when you don't have a way to identify if the needle is in a particular area or not, because the entire abdominal cavity is a big space. So I think surgery, most of us would agree, does not come down to one person doing something fantastically well. I think that's an older model of how surgery works. I think most surgeons in this day and age would say that good surgery results from a million little things done well. So any tool that we can use to our advantage to help incrementally make the ultimate outcome as good as possible is welcome. Certainly welcome in my OR, and I would say for most surgeons, it is welcome. What's happened with surgery in the last 15, 20 years, it's gotten very complex. And all of the tools that we use take learning. We can't just pull something off the shelf and think it's going to work perfectly. And for the Sharps Finder, similar to every other great tool, you have to make sure you spend the time to understand how it works. Specifically for the Sharps Finder, it's designed to detect metal. So if you have instruments or ports that are metal, it would be good to know that before, so you're not fooled when you're looking for a lost needle. So what I usually do is before I put the needle finder, the Sharps Finder, into the body, I'll just test it on some metal nearby, make sure I know what it sounds like. And then when I'm inside, I'll make sure that the robot arms aren't too close to the sensor zone on the Sharps Finder. If you follow those and you take a systematic approach through the abdominal cavity, I think you'll find needles faster than if you were just searching without the needle finder.